All right, today we're playing detective, but our crime scene, it's the human gut. We're going to be looking at some mysterious infections, and the only evidence we have are these strange, subtle clues left behind on medical scans. So let's grab our magnifying glass and start the investigation. So let's start with this idea. What if, when something was going seriously wrong inside you, your gut could send out a visual SOS? A signal a doctor could see plain as day that tells them exactly what kind of trouble is brewing.
Well, guess what? It can. On scans, the gut leaves behind this whole trail of visual clues, really distinct shapes and patterns. For someone who knows what they're looking for, these aren't just shadows on a screen. Nope, they're the key to cracking the case.
Okay, our first investigation kicks off with a very specific, very odd piece of evidence. We're calling this one the case of the coned cecum. It's a classic sign, but here's the twist. It points to more than one suspect.
Here it is, our primary clue, the coned cecum. Now, the cecum is basically the starting point of the large intestine. So when it stops looking the way it should and gets this weird conical shape, that's a major red flag. But a red flag for what exactly?
And when you see them side by side, whoa, the difference is striking. A healthy cecum is supposed to be kind of bulbous and round, but the coned cecum, it's lost that shape completely. It's all tapered and pointed. This change isn't random. It's a clear signal that a disease is at work.
With a coned cecum on our hands, the investigation immediately narrows down to two prime suspects. First up is a parasitic infection called amoebiasis, and the second is a much more infamous culprit, tuberculosis, or TB. So the big question is, how on earth do we tell them apart?
Let's pull the file on amoebiasis. This parasite creates these very distinct flask-shaped ulcers, and it loves to set up shop in the cecum and the ascending colon. But here's the crucial piece of intel. It almost always leaves the terminal ileum alone. That's the spot where the small intestine connects to the large one. You got to remember that detail. It's the key to cracking this whole case.
Now, for suspect number 2, tuberculosis. TB also gives you that coned cecum, usually because of scarring that literally yanks the cecum upward. But here's the dead giveaway, the piece of evidence that breaks the case wide open. Unlike amoebiasis, TB almost always involves the terminal ileum. So if that area is affected, your suspicion for TB just skyrockets.
And TB can leave even more specific calling cards. Radiologists have given them these really memorable names. You've got the Fleischner sign, where a gaping valve and a narrow ileum look just like an inverted umbrella. Then there's the Sterling sign, which tells you there's a flare-up of a long-term disease. For a radiologist, these are the smoking guns for TB.
All right, let's move on to our next case. We're leaving the coned cecum behind and zooming in on a totally different kind of clue, one that signals a whole different level of danger. This is a tale of two ulcers.
Our new clue is deep ulcerations. Now look, any ulcer is bad news, right? But when a radiologist sees ulcers described as deep, man, the alarm bells are ringing off the hook. This isn't some subtle hint. This is a clear and present danger.
The culprit behind these dangerous ulcers is often a virus called cystomegalovirus, or just CMV. This is a classic opportunistic infection, meaning it usually pops up in patients whose immune systems are already weakened. And the big danger here is perforation. These ulcers can literally burrow right through the wall of the colon, which, as you can imagine, is a life-threatening emergency.
Okay, time for our third mystery. And this one has some of the most memorable, just wild-sounding names in all of radiology. We are now officially on the hunt for clues known as the accordion and the thumbprint.
So the primary piece of evidence here is called the accordion sign. I mean, just the name itself makes it curious, doesn't it? What in the world could make a person's colon look like an accordion on a medical scan?
Well, the answer is an infection called C. difficile, or as most people know it, C. diff. It's famous for showing up after a round of antibiotics throws the gut's ecosystem out of whack. What happens is the infection makes the folds of the colon's lining get incredibly swollen. So when contrast dye is used for the scan, it gets trapped between these super thick folds and, boom, you get that unmistakable accordion-like pattern.
But C. diff doesn't just leave one clue behind. Like any good culprit, it leaves other fingerprints. Radiologists will also be on the lookout for something called thumbprinting, where those swollen folds look like someone's literally pressing their thumb into the colon wall, as well as other signs like ulcers and just general irregularity.
For our final case, we are circling back to the cecum. But this time, the attack is incredibly specific, and it happens in a very particular kind of patient. This makes the diagnosis both incredibly direct and super urgent.
This condition is called typhlitis. The key word here is specificity. This is a nasty infection that is limited only to the cecum. And here's the crucial part. It's found in patients with severe neutropenia. That's a critical state where the body has dangerously low levels of a key type of white blood cell, basically the immune system's first responders. Without them, patients are just wide open to these devastating infections.
So, after digging through all these different clues and signs, you know what time it is. It's time for the final review. Let's get all of our suspects in one place and go over their case files one last time.
Let's run down the lineup. If you see a cone cecum, you immediately check the terminal ileum. If it's spared, your prime suspect is amoebiasis. If it's involved, it's almost certainly TB. See that crazy accordion sign? That's screaming C. diff. Deep ulcers in a patient with a weak immune system? You're looking at CMV. And finally, inflammation that's only in the cecum, specifically in a neutropenic patient, that is the classic signature of typhlitis. See? It all comes down to the clue, the context, and the location.
So as we've seen, a coned cecum, an accordion sign, a thumbprint, these aren't just strange shapes on a scan. They're stories. They're distress signals, written in this incredible visual language that doctors have to learn how to read. It kind of makes you wonder, right? What other stories are our bodies trying to tell us, just waiting for the right detective to come along and decode them?